Welcome to Language Access Matters, the podcast that dives deep into the crucial role of language access in public services and businesses. I am your host, Carol Velandia, and I invite you to join me on a journey of discovery and empowerment. Language access is not just a matter of convenience. It is a fundamental human right and the key that unlocks doors to essential services and opportunities. In this podcast, we'll explore the far-reaching impact of language access, examining how it shapes not only healthcare, justice, and education, but also the world of business. Through thought-provoking interviews, insightful discussions, and compelling stories, we will unveil the power of language access. We will hear from professionals who bridge communication gaps to provide quality care for diverse communities. We will explore the intersection of language, law, and justice, and the crucial role that interpreters and translators play in ensuring fair and equitable treatment. We will delve into the challenges and innovations, as well as how language access opens doors to effective communication and inclusion, and how it makes our society more equitable. But our exploration doesn't stop there. We will also uncover the profound impact of language access in the world of business. We will hear from entrepreneurs, industry leaders, and experts who understand the value of inclusive and effective communication and how it drives success in today's global marketplace. Language Access Matters is your platform to understand the significance of language access in these vital sectors of society. We will shed light on the barriers faced by individuals and communities and the innovative solutions that promote inclusion and equality. Whether you are a healthcare professional, a legal expert, an educator, a business owner, a linguist, an advocate, or simply passionate about the power of language, this podcast is for you. Together, we will navigate the challenges, celebrate the victories, and advocate for a world where language access truly matters. So, join me on this enlightening journey as we uncover the impact of language access in healthcare, justice, education, and businesses. Let's amplify the voices of the 25 million people that don't speak English in the United States and those that don't speak the dominant language around the world. Those voices deserve to be heard and empowered, and we need to empower ourselves to build a more inclusive future. Welcome to Language Access Matters. Let's embark on this transformative exploration together. Welcome to Language Access Matters. Today, we have Dr. Bill Rivers, who is a principal at WP Rivers & Associates. He is a former Russian English translator and interpreter, Russian teacher, academic, researcher, and administrator, and for-profit and non-profit executive. He has more than 30 years' experience in language advocacy and capacity at the national level, with significant experience in culture and language for economic development and national security in the intelligence community, private and academic sectors, and publications in second and third language acquisition research, proficiency assessment, program evaluation, and language policy development and advocacy. His company is contracted by the ALC for advocacy support. Welcome, Bill. We are delighted to have you here to learn all about advocacy on language access.
Oh, it's my pleasure. Very happy to be here.
Awesome, Bill. Tell us, how did you start your career as a language access advocate?
As a language access advocate, that happened really right after Executive Order 13166 was promulgated by President Clinton in August of 2000. I was, at the time, a researcher at a place called the National Foreign Language Center, which was a think tank attached to the University of Maryland at College Park. And the state legislature had taken up the idea posed by legislators from the city of Baltimore and from the DC suburbs that perhaps Maryland should also have a language access law that would mirror what Executive Order 13166 did. And, this is 2000, 2001, so it's basically a generation ago. And there was a lot of pushback saying, the kinds of things you hear sometimes around language access. Oh, we're going to have to publish every single document and communication for the entire state government in however many languages. That's going to cost billions of dollars, et cetera, et cetera. First pushback. And the second pushback was, well, it really only seems to matter in a couple of places in the state of Maryland. So the compromise that the General Assembly reached was to have a needs assessment done. And the National Foreign Language Center, being part of the University of Maryland, is part of the state government. So that was assigned to us. Now, I'd already been at the NFLC for a number of years, and I'd been working on language needs assessment at the national level for national security, for business, and so on. And as I said, as you pointed out, I'd been an interpreter and translator and teacher, well aware of language in general. And so that led, I ended up visiting, I think, every state, every county seat in the state of Maryland. We surveyed the entire state government. And of course, there were language access needs pretty much everywhere in the state. And for people who are not from Maryland, it's a long, skinny state on the East Coast, about 400 miles east to west. At some places, only 2 miles north to south. Baltimore is the biggest city. The Baltimore-Washington corridor is probably 80% of the population. Geographically, culturally diverse state, like pretty much every place else in the United States. And yeah, there were language needs everywhere. And then that led to in-depth work being done for a number of state departments to really give them a clear picture on their specific profile of the people they were serving and what they needed to do. It led to the development of training programs, and I did that for a number of years for the state of Maryland. And then by the time I became a lobbyist about 10, 11 years ago, we were looking at language access and, for example, the negotiations around the passage of Obamacare and trying to get language access into the Patient Protection Affordable Care Act, which was, in fact, included in Section 1557. Trying to get it paid for, which wasn't included. That fell out in the final negotiations and something we're still working on. And since then, I've done a number of projects for other municipalities across the U.S., currently working on a project with a county government out on the West Coast to develop and update and refine their language access policies and plans. So, it comes from the obvious, right? So you equal access podcast, your language podcast. We're an incredibly diverse country. 67 million or 68 million people speak a language other than English at home, according to the census. That's probably an undercount because of some of the technicalities of how the census collects its data, and the fact that people often feel pressured. Well-known phenomenon on censuses worldwide. They feel pressured to say their language is the primary language of the country, even if it isn't the language they speak at home. They only ask for one language, so a house like mine, where there are 4 or 5 languages used on a regular basis, depending on who we're talking to, that doesn't show up. And then the number of languages is an undercount. There are only about 350 languages enumerated by the census, but there have been surveys, for example, in the New York metro area, showing more than 600 languages in the New York metro area, which, again, gives you a baseline. There are probably even more languages than that occurring in the U.S.
Yes, Bill.
Right.
And I think I find your path to advocacy quite fascinating, being a linguist and really sort of understanding the great map of our linguistic diversity. You must have numerous examples of challenges faced by individuals who lack language access. Can you think of a particular story or a couple of them where an individual was not offered effective language access and their lives were seriously affected?
Well, we see this all the time. I don't have any stories immediately at the top of my head, but we see this all the time in healthcare, and there are numerous cases where someone did not get the right language access. There's the tragic case, of course, of a Guatemalan child who died in the custody of the Border Patrol because her father signed a document in Spanish attesting to the fact that she was healthy and had no health issues. Well, she was asthmatic, I believe, and died and 6 or 7 years old, died in the custody of the Border Patrol because she didn't get the right medical care. The issue there was the language access that was provided was the wrong language. As we know, there are a lot of indigenous speakers coming across the border, legally or otherwise, to make a better life here in the United States. And just because someone's last name is, Sanchez doesn't mean they're a Spanish speaker. It could be Conjabal, Quiche, Triqui, Chatino, etc. And so the lack of language access, even though there was an attempt to provide it in that case, it was the wrong language access, can have absolutely fatal consequences.
Yeah, and I see that happening a lot with, as you say, with indigenous communities, or even people. People simply will judge by the last name what language they speak, or even by their country. And as we know, even Latin American countries have vast language diversity. So I suspect this kind of mistake happens quite often, that a person will be assigned Spanish because they come from Mexico or Guatemala or wherever, and it turns out they might speak something else. So that happens a lot with our indigenous populations, doesn't it?
It does, and it's often the case that the indigenous speakers will say, "Yes, I'm a Spanish speaker." There's this issue of Latinidad. There's an awful lot of discrimination against um, indigenous people in Latin America, and a lot of societal pressure to use Spanish. Right? It's not at all dissimilar to the kinds of pressures here in the U.S. sometimes around language.
Yeah.
And so someone may say their Spanish is good enough. Someone may say their English is good enough to interact at the doctor's office, or at the community services office or the social worker's office, when it isn't. And I think too often the response on the part of the service provider, the caregiver, the system, for lack of a better word, is, "Oh, okay, Bill says his English is good enough. I can't really understand him, but it's good enough. So I don't have to go pick up the phone and get a OPI or VRI interpreter, and I don't have to ask one of the staff interpreters to come in." And we see that too often as well. There's a lack of understanding of the civil rights nature of language access sometimes, and too easy to say, well, communication is okay or good enough, or the 12-year-old child can serve as the interpreter, and that's deeply problematic in a lot of ways.
Yeah.
But fundamentally, it's a civil right. It's been established as a civil right by Supreme Court case law going back more than 50 years now, by Executive Order 13166, by Section 1557 in its implementing regulations, Section 1557 of the Affordable Care Act. So I don't think there's any excuse not to offer language access. It'll come down to it.
Yeah. And just for our listeners, OPI VRI stands for over the phone interpretation and video remote interpretation. And yes, Bill, sometimes we have the impression that regardless of our efforts in advocacy, or rather our advocacy efforts on language access, we sort of still get nowhere. But I know we have, and things have changed. So, in your opinion, or rather, can you share any successful examples of language access advocacy initiatives that have led to positive change?
Oh, sure. I mean, the whole effort to get Section 1557, to get language access into Section 1557, which was really led by the National Health Law Program and a lot of other health and civil rights and immigration and civil rights groups, but was supported by people from the language industry, from the academic community. That was a huge success. And I think it really, as much as Executive Order 13166 catalyzed a lot more language access, having it enshrined as part of healthcare, as part of equity in healthcare, equal access to healthcare was really important. More recently, we've been able to advocate to get funding for the Office of Minority Health to do research on a universal language access symbol, much as what the Australians have. Now, universal means it will be used universally. It would be ubiquitous. Doesn't mean, that it would be understood universally. And the Australian symbol kind of has a face in the center and then two faces on the side in profile and the sound waves coming out. And to me, that kind of looks like how I felt many days coming home from school and getting yelled at by both my parents. But the idea being that if there's a universal symbol, that's the first thing we did. So Office of Minority Health is working on this. There have been listening sessions. The second piece is we've been able to get funding to the Office of Minority Health then for an educational campaign so that limited English proficient patients know their rights and demand an interpreter up front. And we still, that's part of the challenge of language access, because we see this all the time, is that, community members don't necessarily know they have the right to language access. And it's not always offered, or it's offered kind of in a passive way. There's a sign on the wall that says, if you need an interpreter, let us know, or, the point to the language that you speak, right? But it's not necessarily the intake nurse asking if you need an interpreter or ensuring that that there's a field in the medical record that, okay, this patient needs an interpreter, which is, by the way, another thing we've been advocating for. And I think we're going to get through the regulations that the medical records include that as a matter of the demographic data that has to be collected, name, age, date,
language. Yeah.
Language, interpreter.
Yeah. I'm surprised that it still hasn't happened. In my experience working for hospitals, that sort of comes and goes. So they add it or they take it away, they add it or they take it away. And today should be a standard procedure in all public services that we ask for language, preferred language. So you've mentioned several laws, a 1557 from the Affordable Care Act, Executive Order 13166. Any other language access legislation or policy that you think might be needed to ensure equal language access for all individuals?
So there's some interesting things that are kind of developing on Capitol Hill. Senator Ben Ray Lujan of New Mexico has a bill that would try to regulate generative artificial intelligence, think like ChatGPT, and its use in going from in mediating between English and Spanish. The concern being that it could be used for disinformation, or that it will produce spurious results, which we know machine translation does very often, and AI seems to do pretty often as well. There are things like that. We've been looking at. There's a bill on telehealth that Senators Wyden and Schatz and a number of others have introduced that would require language access be built into telehealth platforms, which is also something we've asked for through regulation, because we're on this technology now. For the listeners, we were delayed 15 minutes getting the technology to cooperate. But you won't notice that, because I'm sure the podcast won't drop 15 minutes late. But the technology is fantastic in that, we can sit here and see each other and talk. Technology does not always, and for telehealth, you have to have patient privacy protection built in, and it has to be integrated into your medical record keeping and everything else. So it's somewhat more complex than, let's say, Zoom, or Teams or what have you. But the enormous growth of telehealth during the pandemic for routine medical care was not accompanied by the telehealth providers, the people making the software, necessarily integrating the option for language access. I think there's only one platform that has it built in. And so what happens with telehealth is that the language companies that are contracted to Kaiser or to, Inova or whatever the healthcare system is, they have to open up the back end and kind of rewrite the code so that they can put the interpreter, have an option to put an interpreter into the telehealth session. Well, the telehealth language, the telehealth bill, it's called the Connect Act or something like that. It has this acronym and it stands for something, because we like our acronyms here in DC.
Yes.
Would require essentially that the telehealth providers have that option for an interpreter.
So this is going to be built into a policy. This
It'd be built, yes.
okay.
Right. So if whatever software platform is being used to deliver telehealth would have to be built to accommodate an interpreter. And that's also something we've asked for in the updated regulations implementing Section 1557. By we, it's a fairly broad coalition of immigrant civil rights groups, health and civil rights groups, language industry groups that has been working on this for a number of years.
I think that is so important that we pay attention to the technological advances and that we adapt, understanding that technology by itself is of no use unless, at least in language still, unless there is a human brain behind it, right? And with the incursion of ChatGPT and all this artificial intelligence, we really need to know how to use it for the betterment of the outcomes of people with limited English proficiency. So I think what you're mentioning, that this is going to be integrated in regulations and policies, is of absolute importance. So I am curious to know, how can language access advocates effectively engage with policy makers and legislators to promote language access rights?
Well, I think there are a couple of ways. If you are an interpreter or a translator in this space, the American Translators Association, which also represents interpreters, has a very active advocacy committee. I'm on that committee. We've been successful at the state level in getting increases for state court interpreters, for example. I think we've 8 or 9 states now that we've been able to help with that issue. So that's one place, and looking for that advocacy committee. The Association of Language Companies, if you're an agency owner, has a very active advocacy program. I'm the consultant for that program, and language access is one of our 3 main, language access in healthcare is one of our 3 main issues, because we know that, and the issue being, there's the awareness and the education and everything, and that's an evergreen challenge. Educating healthcare providers that they have this obligation, and then how to provide language access, educating patients that they have this right and how to request that right, but also getting it funded. And as you well know, Carol, it's essentially an unfunded federal mandate. It's something that comes out of overhead, basically, for the healthcare providers, out of the capitation fee for Medicare and Medicaid providers, and that's can lead to it can lead to decision making based on 2 factors. One, is it minimally federally compliant? Are we checking all the boxes to do the bare minimum, which is not what we want. We don't want the bare minimum. We want it to be done well. And number 2, doing it as cheaply as possible, which we also don't want, because sometimes that leads healthcare providers, in particular school systems, which is another area, to practices which are not actually best practices. So coming back to how do you get involved in advocacy, those are the two main things. And then, local ATA chapters, those are also, that varies from place to place on how active they are in advocacy. But I always encourage people to make sure they're part of their professional association and engaging there, because those are the first place to have advocacy opportunities.
And you talk about having language access as cheap as possible. That is not necessarily ideal. And I think that's one of the biggest impediments from organizations, especially smaller organizations. They think this is a huge expense, and they fail to realize that not having language access sometimes causes more trouble, in terms financial trouble, in fact, because of the number of errors that they can have, especially in healthcare, when there is no access to effective communication, right?
Mm-hmm.
So, are there any specific cultural or linguistic considerations that you think need to be addressed when advocating for language access rights? How can we change that perspective from people?
So part of it is, it's interesting you put culture and you ask about the cultural aspects, because in fact, that's still a very real challenge. And I have been in some very progressive West Coast places over the last couple of years working on language access, and heard people who were in those contexts, diverse metropolitan areas where linguistic, cultural, ethnic diversity of all kinds is all around, right? Still say, well, they should learn English,
Right.
and you doing two things there, othering people by saying they, right, or those people, and then should learn English. And, I go back and when people say this, it just, what do you think they're not?
Trying,
You
right?
think that they're not trying to learn English? Maybe they already have enough English to get by in their daily, and their jobs or what have you. But when they're in your office for, a pre-surgery consult about their minor child, or their elderly in-laws, the level of English isn't there, and they need that communication right then and there. They don't need to be told, come back 5 years when you've mastered English. I mean, that's the logic always just baffles me.
Yeah.
And that, this is America, we speak English. Well, yeah, we do, but we've always had other languages. And in fact, we do not have an official language in the United States.
Mm-hmm.
We do not have a de jure, in a legal sense, an official language in the United States. There may be states that declare they have an official language. It's entirely symbolic because of that thing called the Constitution, and Supreme Court law. So sometimes you get these attitudes, and those attitudes are still out there. And I think that's an evergreen challenge to educate folks that they have a legal obligation. They may not like it, but they have a legal obligation.
Yeah.
They have a moral obligation, right? Mm-hmm. Language access in healthcare it saves lives. It makes patients healthier. There's a moral obligation if you are in healthcare to take care of your patients, to do the best to take care of your patients. So, and again, that is without reference to your own personal preferences and biases and so on. And then for the healthcare providers and the people who are, making the decisions about where to invest and how to spend the money, we have very good evidence now, more than 30 years of high quality peer-reviewed research that shows that quality language access reduces readmission, increases patient adherence to instructions, lowers malpractice rates, et cetera, et cetera. And so there's a financial benefit that far exceeds the cost of the provision of language access.
Yeah.
I think you have to have all of those different arrows in the quiver when you go out to talk to people.
And you actually partially answered my next questions, because you know that equal access language services has been at the forefront of advocacy on language access from a social perspective, but also from a business perspective. In particular, we have designed the course Effective Inclusion Through Language Access, right? Because we basically think that we cannot talk about inclusion unless language access is actually part of the diversity, equity, and inclusion efforts. So the goal is to change our culture precisely around this very topic. But we also aim to help businesses become more inclusive of their limited English proficient population and more sustainable. And we include the language services providers as well. So I guess in healthcare, it's very easy to see, as you say, the potential benefits, not only social but economic, in healthcare are kind of not only what you mentioned, but they are more prominent or more known about, even though they are not as widely known as we wish they were. But do you have any other answers as far as other public services about the potential economic and social benefits of investing in language access services and programs? What is their return on investment? Because I think that sometimes people are hesitant about actually investing on this because they don't see the return. So can you speak to that?
Sure. So one of the key areas I think that really does need a lot of our attention and support is K-12 education. And I say that because, again, language access is it's a little more complicated in education, right? Because you may have children who don't speak English, and they are guaranteed an equal education, an education of equal quality, starting with the former Title VII, the Bilingual Education Act of 1965, which is now Title III of the Every Student Succeeds Act, but also Lau v. Nichols, a Supreme Court case from 1973. So that students who are labeled as English learners, something else that advocates are trying to change, trying to turn that into multilingual learners, because English learner is a sort of a deficit approach. So the first piece is if the kids need support with language, they're supposed to get it. And so that really affects, and the best ways for doing that really come out of the educational side, dual language immersions and so on. And there's a vibrant advocacy community there. Then we come to the parents. And we know that roughly 10% of the children in our public schools are identified as multilingual learners who show up in class not speaking English. And the goal then, that's a whole separate podcast. So, but their parents also may not speak English, right? And there's, again, extensive research, not to the same degrees in healthcare yet, but research, a forthcoming report from the Government Accountability Office showing that if the parents don't speak English, and then that's a predictor, it correlates highly with the overrepresentation of their children, whether the children speak English or not. Overrepresentation in disciplinary issues, suspension, expulsion, etc., lower graduation rates, all the bad stuff, and underrepresentation in advanced courses, gifted and talented programs, accelerated programs, and so on. And then and lots of misdiagnosis, both over and underdiagnosed for special education needs. A lot of that has to do with the quality of communication that's provided to the parents. And that's been a real challenge for school districts. We're both in Maryland. Maryland's a majority state. I'm here in Montgomery County, Maryland, which there are more than 250 languages in the school system. It's the 14th largest school system in the country. And even though they have the best of intentions, it's still a challenge for them in terms of providing information to the parents. And there's both the act of providing the translated information or making sure interpreters are available. There's also the kinds of information that school systems tend to send out can be really bureaucratic and hard to follow, even if you are a high content former education researcher like myself. But that's an area where there are a lot of school systems which are just starting to address language access for the parents. And the return on investment then is, to them, you say, okay, well, if you have better parental involvement, we know that means the kids do better in school. And so that has a long-term societal benefit. The better you do in education, the more you're going to be able to contribute to society and support yourself and your families 30, 40 years down the road. But it also means in the immediate time frame for the schools that you're going to get better test scores and so on and so forth, all the things that school superintendents and such are interested in. So that's one very broad area where there's a lot of work. There's another area that actually is one of the first areas of language access to really get attention, and that's licenses and professional licenses and permitting, where your ability to make a living as a plumber, as a carpenter, as all of the different types of professions which require a state license, and it varies from state to state, and the level of language access varies from state to state. But again, there's case law that shows, that requires let there be language access for certain types of certification tests, professional trade certification tests. And the benefit there is, again, people can build businesses, and they themselves will be able to make more money if they can get that master plumber or gas fitter's license, and they'll be able to serve whatever communities they want to serve. And the state gets a higher quality of service and fewer challenges from poor service, right? If you have the right kinds of licenses and certifications. So that's like two very different things, but you see how it, language access comes up all over the place. It's, and again, the country's so diverse. It's a really big country, but you have to look really hard now to find a place in America where there are not people where there's homogeneity, for lack of a better term.
Yeah, and I think you mentioned something super important about people's talent. The fact that they don't speak English doesn't make them unable to be a very successful plumber or a hairdresser. I remember actually providing services to a man who has an amazing talent. He's a barber, and in order to get the license, he needed interpretation services. And I kept wondering, how is he going to, access the test and the his certification. So it's very helpful that you mentioned that, because obviously the fact that you don't speak English doesn't make you less talented in a bunch of traits. So very important point. Thank you, Bill. And so, as I mentioned at the beginning, your professional trajectory is very interesting, because you from a linguist you became an advocate, and there is a piece on our code of ethics as linguists that we are supposed to be impartial, right? Um, and really not interfere with the communication. So advocating is always a very tricky concept for interpreters and translators. So we're supposed to remain impartial. Can can we be good advocates and remain faithful to our code? What's your opinion on this?
Absolutely. And so, in fact, um, the impartiality comes in the interactions, right? And I very much remember this as an interpreter, and I'm sure you see this all the time in your own professional life. You've got to interpret whatever the other party says, and you've got to render it faithfully and not put your own personal reaction or emotions into it. And that's something that can be very challenging. But the other place where advocacy comes up in the Code of Ethics is, in fact, if you look at, say, the ATA Code of Ethics, which all American Translators Association members agree to when they join, we are supposed to advocate for ourselves and our profession. And I think that's where sometimes interpreters get a little nervous. We're not advocating in the doctor's office or in the IEP meeting, the Individualized Education Plan meeting. We're not advocating, in the courtroom. So, we're serving as an officer of the court. But when we're going to the legislature to demand higher rates, a rate increase for court interpreters, which contracted court interpreters in Maryland had not had a rate increase in almost 20 years, for example, and we got one this spring. That's different. That's advocating for yourself and your profession, for not just yourself, but for everyone, all of your colleagues. And in the end, it's advocating for better language access. It's advocating for the patients, the witnesses, defendants, parents, et cetera, because, if we can do a better job, if we can keep people in the profession, attract people to the profession, keep highly qualified people in the profession, make a living doing this, then there's going to be better language access, right?
Yes.
And I think that advocacy is actually really important.
And there are so many ways to advocate, as you said. I selected advocating for the limited English proficient population, and many people select to advocate for the profession per se. I guess the message could be also that as long as you are outside of the interpreting encounter, you can advocate. And there are so many ways to do that. And we should do it as linguists to improve our profession and the outcomes of people with limited English proficiency, because that's also going to generate better outcomes across all public services for the businesses themselves. So it's not a charity work, in other words, which is something I'm really trying to depart from, this idea that we're advocating because poor people or poor limited English proficient people. No, it's like we're advocating because we really want to elevate the standards of our society, and we shouldn't do it from a pity position, but rather from like a compassionate position and approach. What advice would you give to individuals interested in becoming language access advocates and making a meaningful impact in this field?
I think the first is really two key pieces. One is to get connected to other like-minded folks. And I always stress joining your national association, whether it's ATA, CCHI, Certification Commission on Healthcare Interpreting, NAJIT, the National Association of Judicial Interpreters and Translators. They also have an advocacy committee that's very active. And then if there's a local chapter, join that as well. And that brings benefits far beyond advocacy. It's getting that connection and building your network of peers is just really critical in any line of work, in any profession, to your long-term success, your mental health, your ability to grow and learn.
Excellent. I could not agree more. Is there any question you would have liked for me to ask you? And if so, what would that be?
Well, Carol, you haven't asked me about AI.
Yes, actually, you are right. Artificial intelligence. Why don't we talk about the role of AI in providing or improving language access and bridging communication gaps? Thank you.
Yeah, this is a very complex, fast changing, and I think challenging subject, right? The As some background, I did talk a little bit about the bill that was recently introduced by Senator Ben Ray Lujan of New Mexico. But Congress is looking at how to regulate generative artificial intelligence, the chat GPTs, the bards of the world, because it's clearly a powerful technology, but no one's really sure if it works. There are recent famous examples of significant errors made by ChatGPT. There was a lawyer in New York City who asked ChatGPT to write a legal brief, and all of the citations, 6 of them in the legal brief, were completely fictitious. Some of them referenced real cases, the title of the case or the participants in a case, but completely mischaracterized or fabricated the details of the case. It was a compelling legal brief, apparently, but it was completely a work of fiction. The lawyer in question last week was admonished by a federal judge, and the poor sap said, well, I asked ChatGPT if it was telling me the truth. Okay. It is neither, so I always say this, it's neither artificial nor intelligent. It is not artificial. There's no such thing as artificial intelligence because these are algorithms. These are software programs created by humans. They are not artificial. They're created by humans. And that has all sorts of consequences. Okay. The data that they analyze to learn, the neural machine translation, the neural network, to be that they use to refine their predictions, that these algorithms, the algorithm predicts the next bit of text. That's all it's doing. It's predicting a plausible chain of text to whatever prompt. The data are created by humans. The data have all sorts of biases, have all sorts of flaws. Okay. And that's a challenge that we've known about in the machine translation world for 20 plus years. It's just really hard to overcome the biases that are apparently inherent in the data. So that's the first part. The second part, it's not intelligent. It's a statistical algorithm. So when we come to language access, just on Wednesday, we had the organizing Safe AI Task Force organizing meeting, and I'll read it out here. Stakeholders advocating for fair and ethical AI and interpreting. And this task force had a number of distinguished people on it. I was also on it. And so, you can take that for what it is. But the goal of this organizing committee is to invite stakeholders to form a national task force that would provide guidance on artificial intelligence in interpreting, all different forms of interpreting, conference, healthcare, legal, community, and so on. Because when we step back, well, as I said, first, Congress is looking to regulate this, to legislate it. And it clearly needs that, right? Because there have been these egregious failures of generative AI. People may not remember, but Microsoft about 8 years ago released a chatbot into the world that was turned into a raging Nazi lunatic in about 24 hours, just because of the way the algorithm works. It's like when you're on Twitter or you're on YouTube and you look at the things that get the most responses are often the most outrageous, the most provocative. They're not necessarily the sanest or the most accurate, So that's the first step. And in looking at AI, the other, so you may know this story, viewers may remember that on May 1st of 2021, Slate published a story regarding a civil rights investigation and complaint against 18 state departments of health for the use of raw Google Translate in the provision of information on COVID vaccination, mitigation, and prevention. The little pebble that started that landslide was one sentence on the Virginia Department of Health's homepage, and it said, "La vacuna no se necesita."
Mm-hmm.
Okay. The original English, the vaccine is not mandatory. That's not an accurate translation.
Right, which would have been the vaccine is not necessary, right?
Right. Vaccine is not necessary. And for the reader who doesn't know English, who knows only Spanish, they don't know that that's a bad translation because the surrounding text, the paragraph was, it's Google Translate in a high density language pairs. We like to say lots of data and lots of Spanish English data to work from. It produces usually reasonably fluent output. You wouldn't know it's wrong unless you could access both the Spanish and the English. That led to the Richmond Times-Dispatch reporting on it. It led to the National Health Law Program starting an investigation, getting an investigative journalist that led to 18 different states being named in this civil rights complaint.
Yeah.
One follow-up of that is that the National Coalition on Language Access in Healthcare, there's no such thing. It's a very informal group of us that get together about once a quarter, but it's not a formal coalition. There's no leadership. It's just National Health Law Program, Justice and Aging, National Immigration Law Council, the Asian American Pacific Islander Health Forum, the Association of Language Companies, ATA, a number of other organizations, UNIDOS US, MALDEF, that get together and try to come up with recommendations and provide, input, for example, into the rulemaking process for Section 1557. Because of that civil rights case, we were able to get inserted into the proposed rule a clause that says you can't use raw machine translation for language access unless it is checked or reviewed by a qualified human translator.
Yeah, I really think that we should.
But we don't have that for AI because that rule, the comments period on that rule closed last August. ChatGPT came out in March, and now we're like, okay, we have to revisit that, right? But you don't want. I mean, there's going to be a lot of buzz around this. You're going to see a lot of startup companies referenced in Slater or Multilingual Magazine. So and so, some company gets $3 million to help develop its AI-enabled interpreting product. But we're not, what's the use case? Where is that appropriate? And you look at healthcare, where it has to be right. Humans do make mistakes, but we generally tend to catch them. We generally kind of know when we're making a mistake. We can interact with the patient and the doctor if there's a misunderstanding, right? AI doesn't do that. AI can't do that. Does not recognize its mistakes. Doesn't know that it's made a mistake because it doesn't have sentience, right? There's other technical issues around patient privacy and data protection and so on that, yes, this looks free right now, but the old saying on the internet, if the service is free, you're the product, your data are the product or the thing that is valuable to whatever entity is providing that. There are other kinds of technical questions around that, but this fundamental question is AI really going to provide the quality that is necessary for language access?
Yeah, I think that has to be absolutely clear. The fact that we have more developments in machine translations and AI doesn't mean that we can just let it run amok and by itself. We have to be responsible and ethical when these new tools arise. It's like using, I don't know, I cannot come up with a really good example, but the one that I would like to pose is we are probably aware of tools in medicine like the Da Vinci robot, for example. You can't let the robot do anything on its own. It still needs a human to operate. Same way with AI. And maybe we can come up with a better example, but we should recognize that our profession is not going to be replaced by an artificial intelligence, that you still need to team up with a human, and it might become more effective, the service, but that doesn't mean that it will replace the human. I think that's very important to underscore. Thank you, Bill. So based on your answers, what would be a good title for this episode of our podcast?
Carol lets Bill rant. No, sorry. Advocacy matters.
Yes, advocacy matters. Thank you. Well, Bill, it was a pleasure to have you in our podcast. I always learn something new with you. Thank you so much. And yes, language access matters and advocacy matters. Thank you.
And I'd just like to share with your audience,
Mm-hmm.
and I'll make sure that, Carol, you have access to this so you can post it
Yes,
with this
please.
podcast. The invitation to take the survey on AI and interpreting that the task force has developed, and to participate in subsequent meetings. And that information is on a website, and I'll make sure, I don't want to garble the URL right now, but I'll make sure that you have that so you can make that available to your audience.
Yes, we can put it on the notes.
Yeah, that would be great.
When the podcast gets released. Thank you, Bill.
Thank you.
And that wraps up another enlightening episode of Language Access Matters. We hope you have enjoyed our discussion on the profound impact language access has across various sectors of society. Let's remember that language access is not just an isolated topic. It intertwines with various fields, impacting lives and businesses in profound ways. As we continue this journey together into becoming a more inclusive society where we ensure equal access to services to those who don't speak the dominant language, we want to assure you that our company, Equal Access Language Services, through its podcast Language Access Matters, will be with you every step of the way. We are committed to bringing you thought-provoking conversations, expert opinions, and stories from the field and beyond. To dive deep into the subject matter and engage with leading experts in the field, we will release a new episode of Language Access Matters once a month. By featuring expert practitioners and individuals with diverse experiences, we aim to broaden the scope of our discussions and present a comprehensive view of the importance of language access. We encourage you to stay connected with us through our website, www.equalaccesslanguageservices.com, and our social media platforms. You can join the conversation, ask questions, and share your own stories and experiences. If you want to be part of our podcast, email us to podcast@equalaccesslanguageservices.com. Remember, language access matters to each and every one of us. By understanding its significance and actively working towards its advancement, we can create a more inclusive and equitable society. Thank you for being a part of the Language Access Matters community. We appreciate your support and look forward to sharing more knowledge, inspiration, and empowerment with you in our future episodes.